Good morning. I want to talk about our immune system this morning, and particularly in relation to a report which I read recently I'm reading it here, from the British Society for Immunology. And they recently published a report about the current things that we know about COVID-19 and what we don't know. And there were some really interesting things, I thought, when I read through all of this. Now, as you know, over the last few months, I have kind of investigated all kinds of things and I always go back to the source of the information, and this is one of them. So, one of the things that came out of that report is this statement, and I'll read it for you. The ability to precisely manipulate the immune response to encourage protective responses and decrease immune-mediated organ damage will be vital to manage disease outbreak and limit deaths from COVID-19. This can be achieved through immune modulators, anti-inflammatory drugs, and antiviral therapies. Now, I don't know whether you noticed, but within all of that, there was absolutely nothing that relates to how our immune system responds to certain foods and supplements. Did you notice that that was rather lacking in that statement? This is because, of course, within the medical profession and the drug industry, they're just focused on one thing, and that's drugs. Now, we all know that drugs can work in certain situations, but as far as the coronavirus, or should we call it SARS-CoV-2 or SARS-CoV-2, we just don't know. There's so many things that they still don't know. So in a sense, what I believe is that we should all be taking care of our immune system through as many means as we possibly can. So there's a few other statements. Where should we go? So for example, we don't yet know, the report says, if antibodies protect against future infections. So what that means really is that whatever is decided is the best system of keeping the virus at bay in the future, it might be that then changes because we don't actually have the antibodies within our bodies that are going to keep a future infection away. So what this means is that we need to have some kind of ongoing system that we can all use that is going to protect us. What about the food we eat every day? How about using that as protection? Just a thought. Another interesting situation, it says, and these are peer-reviewed research projects that have been ongoing over the last few months. As I said, it's always important to go back to the source. So another statement from the report: tests for antibodies may produce false positives. And what they're finding is that a lot of the antibody tests are not finding coronavirus as in COVID-19, but what they're finding is aspects of the common cold, which is also a coronavirus. Thought that was really interesting, considering that, you know, there's lots of places talking about the numbers of infections going up. Interesting. Now this is a very important organisation in the UK, the British Society for Immunology. I would think that they know what they're talking about, given that they're looking at reports that have come from all over the world since the global crisis began. Another thing SARS-CoV-2 induces serious disease in fewer people than SARS-1 or MERS. I'll read that again. SARS-CoV-2 induces serious disease in fewer people than SARS-1 or MERS. Now, the reason I thought that was particularly interesting is that with both of those other things, we didn't shut down the world. So why is it that this time we've done that? Just seems crazy to me. If it's actually producing less in the way of serious illness in people than those previous supposed pandemics. You tell me. It doesn't make sense. Another interesting thing is about that same issue. The reason that they think that SARS-CoV-2 induces serious disease in less people than with SARS-1 and with MERS is because it affects the upper respiratory tract. So that means that we have more of an ability to actually get rid of it quickly through coughing and so on, and actually getting rid of the virus that's gone into the upper respiratory tract, rather than progressing down to the lower respiratory tract, which is far more difficult to actually get rid of. But just think of that. If the numbers are less than it was with SARS and MERS, why the heck have we stopped the whole world? Doesn't make any sense. Another thing that this report says that I particularly latched onto, ageing has a negative impact on the immune system. Now, we all know that, but what we also know is that genetics and ageing have some effect on what happens in our body, but it's not necessarily so. We can do so many things to actually alleviate that. So that is a natural process. But if we're eating properly, if our nutrition is top notch, if we're supplementing with the right things, then there's no reason why we cannot age healthily. And apparently 50%, and this is from all of the figures, 50% of excess deaths from COVID-19 are recurring in people over 80 years old. Now, obviously, those people are going to have comorbidities. They're going to be more likely to have diseases which are going to affect the respiratory tract anyway. Their immune system is not able to respond as efficiently as it would be with a younger person. But 50%, and then another 40% are in people from 60 to 79. So it shows that, you know, the official figures in the UK are showing that 90% of people 60 and over are more likely to develop problems with this illness than anyone else. And again, it kind of does beg the question, why have we shut down the world if that is particularly the case? What we should be doing is protecting those older people in society, maybe looking at how we can boost their immune response, and you know, protecting them in that way so that they don't suffer as so many people do as they get older. Another thing, really, I mean, when I looked at this, I thought, yes, absolutely, I agree with this completely. What they have said in this report is that a vaccine is unlikely to occur within the next couple of years, at least if it is done safely. And they referred back to the vaccine that started to be created for SARS-1. And this is what they had said. Potential vaccines for SARS-1 noted in animal studies Remember, in SARS-2, the vaccine, they're not even bothering with animal studies. That for unknown reasons it facilitated rather than prevented carriage of the virus into human cells. So what that is saying is that with the SARS-1 vaccine that they tried to produce, they couldn't understand why it was that in a lot of cases animals were actually getting more ill through the vaccine than they were before. So I just think it, as everyone knows, it's just crazy that they are rushing through a vaccine with no proper testing. I can't think of the words. I just worry at how dangerous this is going to be. And the evidence is there. It's already there from what they've done before with SARS-1. There were tests done. The report actually refers to those tests. But is this actually being taken into account? I'm not sure it is. So essentially what they expect, unless the vaccine is properly tested, what they're expecting to happen or possibly happen is that, people will be vaccinated, and then when they actually come in contact with the SARS-CoV-2 again, that the vaccine will create a situation where it aids the passage into their cells rather than preventing it. It's just craziness. It's craziness, and we cannot afford to have this situation where people are going to be made ill by taking a vaccine which is not proven. Anyway, so that's just a few things from the report. So what do we do about it all? I mean, my own view, as I said before, I feel that what we all need to be doing is to protect ourselves in as many ways as we can. So we have to focus on maintaining a good immune system. And there are lots of ways that we can actually do that. We know that vitamin C, for example, is a brilliant way to maintain our immune system. We also know that there's lots of diseases which can cause that background to an immune system that is deficient. So those things need to be dealt with. Now, whether that's diabetes, or whether it's high triglyceride levels, or whether it is things relating to potential heart problems, whatever it is, it's these things that we need to be targeting. And in other words, the thing that keeps us healthy in the face of any kind of virus is a healthy immune system. Have you actually heard anyone in the government talking about that? I certainly haven't. Anyway, so I hope that in some sense that this is useful, so that you kind of understand, this is the background to it all. This is the reality. This is going back to the source of the information that we're not being told. And we have to do it ourselves, guys. There's no one else out there. We have to do this ourselves. Otherwise we are going to end up with a situation where, more lockdowns, more quarantine, more isolation, more problems with health because of that, more mask wearing. It's just endless. All of the things that have been created through this current situation that we have in the world. So In further videos, what I want to do is to talk about how we can keep our immune system absolutely topped up to the optimum level. But if you have any comments, what you think about the detail in this video, do let me know. As I know the government have said, we're all in this together, and we are, but we have to find ways, I think, as individuals to respond to the situation that we're in. Anyway, don't have nightmares. And, we do have to stay positive, and I do hope that you have a great day, and I will speak with you again soon. Right, you take care. Bye for now.